In this video, you will learn how an AGP report is constructed from CGM data and how to use it effectively in clinical practice. Let's begin by looking at how the AGP graph is constructed. The AGP, or Ambulatory Glucose Profile, turns about 14 days of continuous glucose monitoring into a single 24-hour summary. This graph shows how glucose levels typically behave throughout the day. To create the graph, all glucose values recorded at each time point are arranged in order. Then, the 5th, 25th, 50th, 75th, and 95th percentiles are calculated. These percentiles are plotted and connected using smoothing techniques, which form 5 curves that represent glucose trends across time. The AGP graph helps identify typical glucose patterns while filtering out extreme values that may not reflect a patient's daily life. This makes the graph more representative and easier to interpret. Now that we've seen how the graph is formed, let's break down the key visual components that appear in every AGP chart. One important feature of the AGP graph is the target glucose range. This is usually set between 70 and 180 milligrams per deciliter and appears as 2 horizontal lines across the graph. When the median glucose curve stays within this area, it suggests that the patient's glucose control is on track. Readings above or below the range point to risks of hyperglycemia or hypoglycemia. Another element is the median glucose curve. This line shows the middle value of glucose readings at each time point. It reflects the typical daily pattern and gives us insight into intraday glucose stability. A flatter curve suggests more stable glucose levels throughout the day. Next is the interquartile range, shown as a darker shaded area around the median curve. This area spans from the 25th to the 75th percentile and includes the middle 50% of glucose readings. A narrow band means less variation between days, while a wider band suggests greater variability. This range is often influenced by factors like medication and physiological state. Surrounding the interquartile range is a lighter shaded area called the interdecile range. It stretches from the 5th to the 95th percentile and includes 90% of glucose values. This range reflects broader day-to-day fluctuations, often shaped by lifestyle behaviors such as meals, sleep, and physical activity. Together, these elements allow us to assess both short-term and long-term glucose patterns in a clear and structured way. In addition to the summary graph, the AGP report also includes daily glucose profiles. These daily curves show how glucose levels change on individual days. They are useful for spotting repeated patterns, such as consistent spikes after meals or overnight lows that might not appear in the average graph. This section adds depth to our interpretation and helps pinpoint moments that require clinical attention. Let's now look at how to use the AGP report in real clinical situations. The first step is to confirm data quality. We check whether the CGM device was worn long enough and whether the data coverage is sufficient. Without reliable data, interpretation cannot proceed. Next, we review the glucose metrics to assess overall control, variability, and time spent in target or dangerous zones. We then turn to the AGP graph and evaluate the shape of the median curve, the width of the shaded areas, and the time spent in the target range. This allows us to assess both daily stability and long-term patterns. After that, we examine the daily profiles to detect specific episodes of hypoglycemia or hyperglycemia. These insights help guide decisions around medication, meals, activity, and patient education. To complete the process, we compare the data with the patient's routine and symptoms, ensuring the treatment plan is fully personalized. In summary, AGP reports are a powerful tool that transforms raw CGM data into meaningful clinical insights. Understanding how to construct and interpret these reports allows healthcare providers to offer more personalized and effective diabetes care.